Without further ado, one of my favorite people, State Senator, Republican Henrico, Dr. Siobhan Dunnavent. Dr. Dunnavent, great to have you.
Thank you, John. Thanks for having me on.
Oh, we always love having you on, Dr. Dunnavent. You know that. I've always been encouraging you to run for governor, run for this or that. So I think you're one of the best people out there. Listen, you're a doctor. You've delivered so many babies, thousands of them, and you got a great reputation. Schools are getting closed. Henrico closing. Hanover was going to open, but now they're under pressure to shut down from the left. Tell us what is going on with schools in Virginia. What are your thoughts as a doctor?
Well, I will say that my thoughts as a doctor are framed very significantly by my fellow doctors, and the American Academy of Pediatrics did an amazingly robust analysis of the risks associated with COVID for both students and teachers. And they also looked at the risks of children not being in school this fall. And they said resoundingly, the most dangerous thing for our children is to not go back to school. And they called on schools to find a way to go back safely. Unfortunately, that is not what our governor called Virginia to do. Our governor sent down a bunch of regulations that were very confusing for the school boards. And instead of saying, find a way to open schools safely, because we know this is so important, he said, find a way to open school with these guidelines. And I call it an unsolvable riddle. There was no way to open schools with those guidelines. Mm-hmm. And they were not predicated on best evidence based on the data for incidence of virus in Virginia. Mm-hmm. They were not predicated on the recommendations from the medical community for our children. Mm-hmm. And schools now are choosing virtual only. And the catastrophe here is that parents now have to figure out, with 1 month left, what they do next year. And most of the parents I've talked to, I know in Henrico, 62% of the parents said they wanted their kids to go back bricks and mortar. I will tell you that on the survey I saw of the teachers, that the teachers actually said 91.7% they were going to go back to work when school opened. So I don't know how we got here. But the bottom line is now we need to figure out a way to support parents. This is an unexpected expense. Mm-hmm. Children have to be somewhere. They have to be somewhere. So instead of being in the schools that we have funded and invested in where all the subject matter experts on kids are, like counselors and social workers and teachers, mm-hmm. our kids are going to be somewhere else, and we don't know where without those subject matter experts. So I and several other Republicans in the legislature are going to be proposing a lot of funding for those families and parents so that they can get grants and they can get portable money to help them pay for education and for child care and to try and figure out a way forward that they shouldn't have to figure out.
Dr. Dunnavent, you live in Henrico. You're a state senator there. So what do you say to your Henrico constituents that would like to send their children to school but now don't have that option because Henrico School Board voted it down, and I guess what if they've gone to 100% virtual or distant learning? And by the way, all the facts are in on that. It's been a disaster. Kids didn't learn anything. My son teaches in Mississippi, and he told me that on any given distance learning class, 50% of the people didn't even log in, right? So, I mean, that's just one example of many. I think the average was only 35% logged in on any given class day. So it's kind of horrible results. So Henrico shut down. What do you tell your constituents?
Well, I was on the phone with my constituents last night, or on the Zoom call. You're probably familiar with Virginia Back to School, and there's a branch of that for Henrico. And I have to say, I wondered what I could do to help them. These are mothers and fathers that were speechless, looking at me through the Zoom call saying, what am I going to do? We both work. I had a mother on there who has 3 children. She and her husband works at Lowe's. She's been a CNA this whole time. The oldest child is 12. They've been home alone this whole time because they were both essential workers. And the children have some learning challenges, and she doesn't know what she's going to do, literally doesn't know what she's going to do this fall. So we're scrambling. We're going to reach out and try and encourage all of the child care centers to expand, and I think we're going to need to give them grants and incentives to do that. I think that there's a litany of things we can do at the state that will help give parents some tools and some funding. But the honest to God's truth is they are absolutely distraught. And the schools told me, we don't have time to plan. We can't pull this off. We've got to take that first 9 weeks. Well, parents don't have time or resources to plan. And they're abandoning this decision and this solution to the parents. It's not what's in the best interest of our kids. And that's what's so baffling to me. When I can't understand why a decision's being made, because you can't support that decision with any evidence or expertise or data, and it hurts innocents like children. I'm baffled, and we're just going to have to scramble, and money needs to go to these families is the bottom line.
John Fredericks Radio Network, Trucking the Truth Across America. We're with State Senator and Dr. Siobhan Dunnavent, Republican, Henrico, Virginia. So, Dr. Dunnavent, let me just ask you this straight up. Trying to get money for various daycare centers. One loophole that the governor did allow is that private schools can make their own decisions. My son goes to Atlantic Shores Christian School. They're opening on September 8th as normal. That's what they're doing. I'm not in this situation, thank God, with our own family. But here's my question. If you can go to private or Catholic school, like my son does, and that's fine, and you can go to a daycare center, and that's fine, why can't you go to school? Like, what's the difference? I mean, let me ask you something. Take that, and then if you can work at Walmart, and you can work at Lowe's, and you can work at Amazon, and you can work at Starbucks, and you can come in contact with people all day, those are essential workers, I guess, but then you can't teach school. I mean, how does this, where's the math here? Is there any science or data that backs any of this?
No. And that's what's so frustrating is that, a lot of times when you're looking at an issue, you can see both sides, and you have to make a qualitative or a quantitative decision about what you think is best based on your principles. There is no data to support this. Every piece of data I can cite for you supports the schools being open. Let's just look at childcare in Virginia. For the last 17 weeks of this pandemic, 60% of our childcare centers have been open and functioning. They have not had social distancing. These are very small children. You can't make sure they're not around each other. They have had cohort social distancing, and these children have been there all this time, and there has been one outbreak. They didn't have to close the center. There were no hospitalizations, and we have managed this very effectively with those kids being safely cared for. So there is no evidence to support this. I think there was misdirection from the state that set the schools up working to solve a problem that was the wrong problem. The problem should have said, what do you have to do to get schools safe for teachers and for children, and do it really effectively, because we've got a lot of good guidelines to help you, and we have a lot of essential businesses that have been open. That's not what they were told. They were told, follow these guidelines that were in conflict with American Academy of Pediatrics, with CDC. The guidelines were changed halfway through. It was chaos. And chaos begets chaos. You've got to show leadership that results in an outcome that is evidence-based, and we have failed to do that.
Well, we failed miserably. We're with Dr. Siobhan Dunnavent, Republican State Senator, Henrico, second term, and she's also a pediatrician, and she's been delivering babies in the Central Virginia area for many, many years. Dr. Dunnavent, so let's get to the Hanover example. I thought Hanover got it right when they said, we're going to go school full-time, 5 days a week. We're going to keep it clean. We're going to do certain protocols, but you're going to go to school. School's open, and we're going to serve hot lunch and everything else. So you're going to go to school. But we also understand that some parents are not comfortable. So if you don't want to go in classroom 100% of the time, you can do distance learning 100% of the time, and we'll do the best we can. We'll have tools available for your child. Okay? That, to me, made sense. So if you are a parent, you're not comfortable, I get it. You have the option in the public school to stay home. But if you want to go to school, you can go, right? Now that's coming under fire, and they're under such social media pressure. They're going to have another meeting to close it down after they had a meeting to open it What makes some sense of this for us?
Well, I can't make any sense of that. I hope Hanover will hold strong. I think they made a decision that is unpopular with people who have a different agenda than taking care of our kids. And I think that that's what's hard about leading is that pretty much nowadays half the people are angry with you all the time. And that's why you need to feel liberated to make decisions based on evidence and in the best interest of your constituents. That is the absolute right decision. It's even more right for Hanover because they have controllable variables. It's a small school district. They have just a few schools that they need to manage, and they have the capacity to do social distancing. So when I brought up Hanover, when I was talking with my Henrico superintendent, she said, it's not really a fair analogy because we have so many more schools and so many more children, and we don't have the capacity to do some of the things Hanover can. Mm-hmm. And so Hanover is a perfect location. But in this case, I honestly believe, and, I think there's a medical way to look at this and solve this problem, and that's how I address it. But I cannot deny that there is a political agenda afoot, and it seems to be mostly with groups that are interested in bringing collective bargaining and teachers' unions in. They can garner favor with teachers by proposing that they're protecting them, but they're giving them misinformation because, A, these teachers are not at risk when you look at the statistical analysis, not no risk. COVID is serious. But the risk for anybody under 50, and I went and looked at the number of teachers in Henrico that are under 50, and it's a full 80%. The risk under 50 is incredibly small. If you have risk factors that make your risk for COVID higher, you can be a virtual educator. But 91.7% of those teachers wanted to fulfill their contract and go back to school when it opened. That's what they said on the survey. Mm-hmm. So the problem here is that people are hijacking the agenda for their own benefit instead of doing the right thing. And that is very hard to watch.
So sitting there as a pediatrician, as a doctor, and as a state senator in Virginia, one of 20, you sit there and you're seeing the politicization of our kids' education, kids turning into basically political pawns, if you will, collateral damage for the left in order to pursue a bigger political agenda, which is empower more teachers' unions. That's number one. Number two, obviously, is beat Trump. I mean, obviously that's the thing because you've got so many of these schools saying we're going to, reopen November 5th, right, after the election's over. So we just have to call it out for what it is. I mean, this is the complete politicization now of the school system using our children and their education and just saying it's, basically collateral damage for power.
I think there are people who are honestly afraid, but they're afraid because they haven't been told the honest truth. And I think that, that when asked in an anonymous survey, our teachers were there to serve. When they're, when they're given misinformation and scared, there's uncertainty, and uncertainty makes it hard to build consensus. So I think that's definitely happening. I think what you've described is certainly a very possible scenario. I don't know what the motivation is of any other entity. All I can say is this is unequivocal. There isn't really room for debate here. The numbers, the percent positive in Virginia, with the exception of the Tidewater area, which still I believe is in check. But the numbers across the rest of Virginia are fully within the guidelines for schools to reopen. The risk analysis of COVID for both the teachers and the children is incredibly low and lower than other risks that we face every day with open schools. The risk of not being in the schools for children, we've got to think about kids who don't have a safe place to be, who don't have, even families with resources, 2 working parents, 12-year-old and 2 younger children home alone all summer. This isn't this isn't how we're designed to be. We've invested in our schools so that our kids have a safe place to be with subject matter experts to contribute to their development. And we are leaving them somewhere else, and we don't even know where that is. It's not okay.
Absolute insanity as far as I'm concerned. No question about it. And look, no numbers support any of this. I think that's what's so disturbing to me and many others. If you look at the American Academy for Pediatrics, they put out a statement strongly advocating that all policy considerations for the coming school year start with the goal of having students physically present at school 5 days a week. You also look at what's been done in other countries. In Germany, they've been open since the spring. The German government concluded that schools had no impact on virus increase or prevalence. The Netherlands, schools have been open for 4 months. They say they didn't find any transmission among children or from children to adults, that it was under 0.5%. That's one person out of 200. Empirically, COVID cases didn't rise in Europe after schools reopened there a couple months ago. People say, well, there's a 2-month lag. Well, they've been open 2 months. So all of the evidence says nothing is going to happen, yet we're closing schools. But I thought this was all about the science and data. I mean, this is what, for average people looking at this, Dr. Dunnavent, for weeks we heard science and data, science and data, science and data. Okay, well, now we have the science and data, which says open up the schools, and now it's, well, that science and data doesn't matter because that doesn't fit our larger political power narrative. I don't know how you come to any other conclusion.
I'm incredibly frustrated by it too, because this is my world. Reviewing data and accepting that data evolves as you learn more. It's a discipline. You can't get stuck without looking at all the pieces, even the pieces that maybe you don't want to see. You have to look at everything and be open to what it tells you. But I think part of the problem here is that there will be more cases. The increased number of cases we're seeing across the country are because we are mingling more. The question is, does that result in actual risk?
No.
And if we protect the populations that are at risk of getting sick, being hospitalized, and dying, no, it doesn't.
Yeah,
it contributes potentially to the solution.
Right.
And so kids are going to get sick. Yeah. There were positive tests that were found in the child care center. So the illusion that there's a narrative that's happening that teachers or whoever the advocates are in favor of not opening are saying, I'm not going if I don't feel safe, and I don't feel safe because people are going to get sick. Well, it's true people are going to get sick, but that doesn't mean they're not going to be safe. We should have been spending this time building things like leave time, figuring out how to, make workman's comp help cover teachers if they got really sick, making sure we had the schools clean, coming up with protocols for contact tracing in schools. We should have done all the things we needed to do so that people could feel safe even though there would be cases, but that is not what we did.
So in Florida, with all the political narrative hype going on in Florida, so I just got off the phone with another doctor there, lives in Southwest Florida, which is basically the epicenter of the case outbreak. So in Florida, 97% of those that are tested positive, right, do not go to the hospital. So only 3% are going to the hospital. Of the 3% going to the hospital, right, 97% of those are fine. And if you take the numbers in Florida that are under 85, half the people that have died are over 85. So, I mean, you just start running the numbers, and like the Dr. Gross said, more people in Florida have died from the flu than COVID-19, yet you would think there's going to be body bags on cul-de-sacs. He also said that when you look at the number of COVID beds available, not ICU beds, because you got people in there for different reasons, but COVID beds that the various states have made available in case they're needed, he said we have an 80% bed capacity. So this idea that hospitals are going to get overrun is also fake. So, yet we're not educating our children. For an average person looking at this, like you said, looking at the facts and not the fake news, how do you justify keeping your kids home again? I just,
I
for the
think
life of me, I can't fathom this.
I can't either. And I think retrospectively, when we look back on this, we'll shake our heads and go, what the heck were we thinking? Because I agree with all that information. Hospital utilization now is not even all the way back up to where it was before the shutdown. And ICU bed availability, Virginia right now is using 21% of our ventilators. That's it. And so we've got, we are absolutely have all of the numbers. The problem is the media doesn't want to talk about the numbers that reflect how we are managing a steady state. And that's what we have to have. We're trying to have a steady state. And they want to talk about the new positive tests. But when you look at the positive tests in perspective with the negative tests, when you look at the positive tests, why aren't we reporting the age group of the new positive tests? If all of those are 20-year-olds, then that is the natural course of interaction with a virus that we don't yet have a vaccine for. But it is not a risk for, the death or ICU hospitalization, except for extraordinarily rare instances. And so, we've turned risk analysis on its ear. You're right, especially for kids. 190 kids died from the flu last year. 30 kids have died from COVID. So where's our risk analysis that we've applied in the past? Where's our risk tolerance? Life is not risk-free. You just have to have a perspective of risk tolerance that makes sure you weigh the positives over the negatives. And in this case, the much heavier negative is keeping our kids out of school.
It's called elect Joe Biden. Simple. Dr. Siobhan Dunnavent, yes, you continue to be my favorite guest in the whole world ever. It's true.
Thank you.
I'm not going to deny it. Thank you for being with us today, and thank you for all you do and for putting this out there. Thank you so much.